Today I'm going to be talking a little bit about some of the red flags that might show a child has some feeding difficulties. So one of the first things you might notice is different GI issues, whether the child has ongoing and excessive vomiting, if they're having constipation or diarrhea, if they're having reflux symptoms, or ongoing choking, gagging, or coughing related to eating, or if they've had a really traumatic choking experience. Those could be some red flags. If the child is having difficulty gaining weight, or if we notice that they're losing weight, that's a red flag. Some other red flags include having a really limited diet. If we think about all of the varieties of foods out there, if there's a child that's eating 20 or less foods, that's a red flag. If the child is reliant on an oral nutrition supplement like Pediatric or Kate Farms, these are providing the child nutrition, but if that's the primary source of nutrition past that infancy and toddlerhood, those could be some red flags. And finally, if you're a parent or a caregiver of a child with feeding difficulties and you yourself have struggled with a disordered relationship with food or an eating disorder, and your child is struggling to gain weight and that process is causing you a lot of stress, that could be a red flag. Not that it's not your fault at all, that your child has feeding difficulties. However, that could be an indication that maybe your child just needs some extra support with their feeding abilities.